Heart rate variability, or HRV, is one of the most important indicators of our internal well-being and overall well-being. Actually, heart rate variability, or HRV, indicates the well actions and reactions of our cardiovascular system, our heart, and also the relationship between our heart and brain, and heart and respiratory and breathing system. Actually, heart rate variability is different from heartbeat or heart rate, and heart rate variability, or HRV, indicates the variance or variation or difference in time interval between the successive heartbeats. When our heart beats 60 times per minute, it means that all beats not occurs in the same exact time. Between each successive heartbeat, there would be some differences. And the higher levels of heart rate variability or differences between successive heartbeats are very good and helpful for individuals, and indicates the overall well-being of our cardiovascular system and overall well-being of our internal body and our actions and reactions of our body. That's why it's very important to assess heart rate variability well through the use of helpful and trustable techniques and technology, and also report the results to help other people, and also use heart rate variability and heart rate variability assessment as a tool for assessment, and also as a practice to improve the levels of our heart rate variability and our heart coherence and also internal well-being. The results from the assessment of heart rate variability will be helpful when we assess, correctly analyze, correctly, and also report clearly and correctly. Because when we do not use the right procedures or processes, or we do not analyze and report correctly, we may mislead individuals, and the results may not be, actually will not be helpful. But when we assess, analyze, and report heart rate variability correctly, the results would be helpful for ourselves and others as well. We can use different kinds of technologies and procedures to assess heart rate variability. We can use M-Wave technology, M-Wave tool and software is a very easily applicable tool. We can use some other heart rate variability biophysical technologies, and also we can analyze through ECG or EKG, and through the analysis of the differences or variations in time intervals between PQRS peaks or PQRS complexes based on the ECG graphs. Actually, when we analyze based on the ECG graph, when we have the graph from ECG like this, when we have the information from the successive it means that when we have such kind of graph which shows from this wave, which indicates the P wave, or the depolarization of our atria in our heart, and the starting of PQRST complex, which is a complex cycle of heart beat, or the beat of our heart. And when we assess heart rate variability, we do not assess the numbers of our heartbeat, but we assess the differences in time in each successive beats when occur in our heartbeats. Actually, when this occurs in 0.9 second, if this one occurs in 0.95, and this occurs in 1.1 second, all of this are seconds. It means that when our heart beats 60 times per minute, between each successive beats, there are time differences in time variables. And it's very good because when the times, the successive times variables are high or continually very high or acceptable level, it means that we can overcome the probable challenges and we can reach an optimal level of heart rate variability and internal coherence immediately. But when our heart rate variability is low, it means that we cannot recover immediately from probable challenges and we cannot reach in the optimal level of heart actions and reactions immediately. That's why it's very important to assess our heart rate variability and improve the levels of our heart rate variability. Actually, we can assess or analyze the data through the use of two sections. At first, we can just analyze the mean times, given times or time intervals in each successive beats or complete PQRS complexes, which indicates a complete cycle of orbit. We can analyze both the NN interval or standard deviation of NN intervals. Actually, we can use both RR intervals when we can say, when we assess the RR intervals, it means that we do not consider the quality of breathing or RR PQRS complexes intervals. We just assess the numbers and data we received from the graph or from the data through the ECG graph or the assessment of heart actions and reactions. But when we consider some affecting factors or values that may undermine the clearness of data, like ventricular or supraventricular extra systoles or some atrial fibrillations, or some abnormal activities of our heart, and also when the pulse-making process starts from maybe AV node or some other portion instead of AC node, such kinds of heart actions can be considered abnormal. But when we try to just assess the data from the normal QRST, especially RS waves or between RS waves, that's why we use, instead of RR intervals, NN intervals. NN intervals means normal to normal. It means that we just consider the normal RST, QRS waves, or the successive beats that recorded based on the normal heartbeats and normal pacemaking, which starts from the senatorial node or AC node, which is the main pacemaker of our heart, not by other sections. That's why when we assess, we have to consider that the data collected normally in the QRS or complete PQRS complex data or the complex graphs are collected based on the normal actions and reactions of our heart, and based on the AC node activities and starting the pacemaking processes or pulse from the AC node. And also we can conclude or assess based on the differences between the times, actually between two successive data or successive beats. Actually, we can assess either the data, the time given, the time interval given in each beats or in each PQRS complex, which are different from each other. The first one is 0.9 seconds, the second one is 0.95, and the third one is 1.1, a little longer second. Or we can find the differences, like between the first one and second one, or the second one and third one. They're analyzed based on that. We can use either the standard deviation of normal to normal intervals or RR intervals, or we can use the RSSD, the root means successive square difference, to find the data, or we can use both the mathematical analysis processes and some geometrical processes and method like the using of some histogram and some shapes and some graphs, or we can use each of them, maybe just analysis for geometrical. We can use both. If we use some geometrical method, we can use some histogram, some graphs. If we can see this is two graphs from the heart rate variability of two people. The first one is the normal and from a coherence heart with around 0.1 hertz, with 0.1 is 0.1, the frequency of 0.1 is the optimal frequency, which indicates a coherence heart. And the second one is incoherent and abnormal graph. It is choose from two persons. One is in a very good heart rate variability and higher level of heart rate variability in coherence heart, and the second one is in an incoherent situation in his heart rate variability is very low. But it's better to use both, to use analysis and to use also a geometrical method through the use of some graphs, histogram, or some shapes. That's why the main purpose of assessment, analysis, and report of HRV is to help ourselves and help other peoples to know the effectiveness of heart rate variability and to use some particular techniques to improve their heart rate variability or HRV to have better or higher heart coherence, internal coherence, and higher level of overall well-being. I'm Dr. Sarwari. If you think such videos and information are helpful, and you want to receive some more, please subscribe the channel. Thank you.